Alright guys, my name is Jamie Letchworth and we are going to be covering cardiovascular accidents, also known as strokes. I would like to introduce you to a gentleman named Andrew White. Andrew is a 24-year-old man that has been using heroin about twice a week over the last year. He is unable to maintain a job at this time and recently moved back in with his widowed mother. He came home one evening and was sitting at the kitchen table when his mother noted that he had slurred speech on his right and right-sided weakness, unable to smile and move any extremities on his right side. His mother quickly moved him to the floor and called 911. Andrew was lucky to have his mom move so fast. He arrived in the ER within the hour of the onset of his symptoms. A full workup was done, and sadly, at the young age of 24, Andrew suffered his first ischemic CVA and was started on thrombolytic therapy to restore cerebral blood flow. Luckily, Andrew suffered no deficits. This presentation was created for my patient, which is Andrew. And I just wanted to give you a little backstory on where he came from and his story. So let's talk about CVAs. There are two kinds of strokes. There's an ischemic stroke and a hemorrhagic stroke. Ischemic stroke occurs when an artery to the brain is blocked. The brain depends on its arteries to bring fresh blood from the heart and the lungs. The blood carries oxygen and nutrients to the brain and takes away carbon dioxide and cellular waste. If an artery is blocked, the brain cells cannot make enough energy and will eventually stop working. If the artery remains blocked for more than a few minutes, the brain cells may die. This is why immediate medical treatment is critical. And we are focusing on ischemic strokes because this is the one that the gentleman Andrew White suffered from. Some statistics. Note the acronym FAST: face drooping, arm weakness, speech difficulty, and time to call 911. And just a couple more little tidbits here that you can kind of look at on your own time. CVAs are the third leading cause of death in the United States and one of the leading causes of disability. There are 700,000 new strokes per year. About 150 of those are fatal. 80% are from an ischemic event and 20% are from a hemorrhagic. Most ischemic events are due to atherosclerosis or embolies. And you can kind of check this out. About 55,000 more women than men have a stroke each year. 31% of stroke victims are under 65 years old, the youngest being 2 years old. And a stroke can occur every 40 seconds in the United States, so very common. Just a few statistics to look over. What are some risk factors for CVAs? There is modifiable ones, things that we can change, things that we can help prevent further CVAs, and there's non-modifiable ones. Non-modifiable would be your age, race, ethnicity, or hereditary. Modifiable would be hypertension, glycemic control, hypercholesteremia, smoking, obesity, physical activity, carotid stenosis, AFib, alcohol consumption are factors that can all lead into CVAs. So in Andrew's case, we can contribute his substance abuse. Not only was he using heroin, but also the alcohol consumption and tobacco use could have been a heavy contributor to a CVA, and not to mention that his mother was a widow and his father passed away recently from a massive CVA not too long ago. Andrew's lucky to have recovered from his with little to no deficits. So you got to take note on the ways that he can change his habits from day to day. Exercise, smoking cessation, not using substance or, getting help for his substance abuse, eating well, all things can help prevent further CVAs. Signs and symptoms of a CVA depend on what area of the brain is affected. The right hemisphere, symptoms are left-sided sensory loss, left-sided weakness, slurred speech, and visual loss. Left hemisphere symptoms are right-sided sensory loss, right-sided weakness, slurred speech, visual loss, difficulty reading, writing, or calculating. And the posterior hemisphere symptoms are motor or sensory loss in all four limbs. Limb or gait ataxia, slurred speech, amnesia, vertigo, with or without vomiting. some will have all these symptoms and some will have no symptoms. But kind of gives you an idea of what part of the brain can be affected. Act fast. Just remember that acronym FAST. A couple more little tidbits here that you can kind of read over. Management of a patient with a CVA has to be aggressive. All patients with a CVA should be seen within the first 24 hours by speech, physical, and occupational therapists. Patients should be started on antiplatelet or anticoag agents based on their risk factors. Patients should arrive within the hour to an ED or within 3 from an ischemic event. Patients who arrive within the emergency room within 3 hours of the ischemic event, should be considered for thrombolytic therapy. It is very important that a full workup should be done to consider what type of CVA is done to further your care on how you would treat it. Was it hemorrhagic or was it ischemic? It's very, very important. A full workup consists of a CT or MRI of the brain, ECG, chest x-ray, CBC, chemistry profile, PT, PTT, urine toxicology screening, lipid profile, respiratory status, echocardium, etc. It's very important so we can treat these patients accordingly. So just remember, act fast. Lifestyle changes are a must. We talked about this for the modifiable factors, and here's a few to name a couple more. Some we went over and some we did not. Non-modifiable risks, age, race, family history, and modifiable, of course. All how you live your day-to-day life. What do you do in your day-to-day routine definitely has an effect on, your health, and we all know that. Thank you for listening to my presentation here. I want to note that a lot of my notes came from this fabulous website, Internet Stroke Center. A lot of statistics, a lot of places to get help, questions to be asked, clinical trials that have been done. You can find this at strokecenter.org. Have a good evening, guys. Thanks again for your time.